Hello, and I'd like to welcome you today to the WHO Regional Office for Europe's Facebook Live for World Antibiotic Awareness Week. We're really happy to have you join us. This week annually gives us the opportunity to focus on an extremely important topic, and really an urgent topic. Antibiotic resistance is a growing threat to public health. As a result of infection with drug-resistant bacteria, an estimated 700,000 people die each year worldwide. A total of around 33,000 die annually in the European Union and European Economic Area, and this number is increasing all the time. Today, we're lucky enough to have two experts on hand who are going to be able to answer your questions about antibiotic resistance and why it matters, or should matter, so much to all of us, because it affects all of us. We hope you will follow along for the next little bit, and please make sure to ask your questions by leaving a comment for us. We'll do our very best to get through as many of them as we can in the next little while. Before we dive into our questions, I'd like to introduce our two experts. We have first Anne Lise Ryel, who is the Secretary General of the Norwegian Cancer Society. So thank you so much for being with us today, all the way from Norway.
Yes, thank you for inviting me.
And we also have with us Danilo Lo Fo Wong, who is our Program Manager for Antimicrobial Resistance here at WHO Europe. So thanks, Danilo, for being with us.
Thank you for having me. Yeah.
I'd actually like to start with you, Danilo.
Sure.
And I'd like to start with a sort of general question, which I think a lot of our viewers may not really know the answer to, which is, we hear the term antibiotic and antimicrobial, sometimes used sort of in the same breath almost. Can you just give us a really brief explanation as to what the difference is and why we use one over the other?
Well, the thing is, antibiotic resistance is a form of antimicrobial resistance. So antimicrobial resistance refers to all kinds of microbes, like not only bacteria, but viruses, fungi, parasites. And antibiotic resistance is purely for bacteria.
Great.
That's the difference.
So antibiotic is more specific, whereas antimicrobial is broader.
Is a more general term. Absolutely.
Okay, great.
Yeah.
So hopefully that won't be too confusing if we use them in different contexts.
Sure.
I'd like to come back over to you, Anne Lise, and we'd like to dig today a bit more into a topic that's a bit more specific, and that's how antibiotic resistance is related to cancer. Happily, we live in an era where more and more people are surviving cancer. I believe the statistic I've heard is that 7 out of 10 people in Northern Europe are alive 5 years after diagnosis.
That's
so
true.
That's very encouraging. But I'm sure people watching today may be wondering, what is that link between antibiotic resistance and cancer treatment? So could you describe for us maybe the role that antibiotics play in cancer treatment?
I understand why you ask, because most people do ask this, and so did we in our cancer organization, because it wasn't obvious. But the thing is, when you treat cancer, it's very advanced, and you need a surgery, you need chemo, you need a lot of things, and very often you get an infection, and often a very severe infection, and your immune system can itself kill the infection, but when you are treated with cancer, your immune system is also very low.
Yes.
And that's why you need antibiotics to kill and get rid of the infections.
Right.
And actually, at least 1 out of 5 that are treated of cancer needs antibiotics because of infections.
Okay.
And even worse, some of the cancers, like leukemia, you can't start treating without knowing that you also can use antibiotics, because you are sure that you will get infections.
So basically, you're almost entirely dependent upon antibiotics in that case, for example. You can't treat one without being able to use the other.
That's very true. And even also, when if you are you are a survivor, but you are still you have side effects of the cancer treatment. Very often your immune system is still very low, or in periods of time it is, and you easily get infections. So you also will need it after the treatment. So what I'm really telling you is that almost anyone treated by cancer will need antibiotics for these infections.
Right.
And that's why in the future, not 7 out of 10 will survive cancer. There will actually be many people die, not of the cancer, but the infection.
Right. Of course, you mean if we get to a point where
we are already
we no longer have effective and working antibiotics.
Yeah, but we are already there.
Yeah. Yeah.
Yeah.
So
even in our countries, we see that, and the reason it's so important to talk about it is that cancer, we all are affected by cancer, either
course.
ourselves or our families. We all know someone. It's one of the biggest diseases we have.
Yeah.
That means there's a lot of people out there that will get cancer themselves or one of the near ones, and
Sure.
they will have to face this.
Sure, and you raised such an important point, which is that some of us say, well, our body can fight certain infections on our own, but there are many instances in which we can't do that. Our immune system is compromised, or the infection is, too much for our system to handle. So, obviously, this is something that really will affect all of us, or as you say, affect someone we know and care about. So we'll come back certainly to this topic, and it's really fascinating, something I think that is not fully understood by most people, this link. But I want to turn to Danilo now, and I want to ask you about something that we're hearing more and more about. Obviously, we know that there's this urgent need to tackle the problem of antimicrobial resistance, antibiotic resistance. And sometimes we hear people say this problem is too big for any one sector.
Yes.
So we hear about this concept, having a One Health approach. What does that even mean? Can you tell us?
Yes, I can try. Because One Health is actually, it's not a new concept. It's been quite debated also among those that we consider part of One Health for a long time. But I think we narrowed it down now.
Okay.
So One Health is actually, it's a recognition that antimicrobial resistance is really an issue that not only affects human health, but also animal health, and it's connected through the environment, either directly or indirectly. So it's a recognition that health basically is interlinked between the different sectors, human, agriculture, food, etc. And that this is also why it has to be a multi-sectoral approach to address antimicrobial resistance.
Sure, thank you.
So.
Can I ask you to get a little bit more specific? Give me an example of why there is that link between human and animal health, for example.
Yeah.
What do we see happening in agriculture, for example? And how does that affect our use of antibiotics among humans?
Yeah. So one of the side effects of when penicillin was discovered, it was also discovered that animals apparently seem to be growing faster, which of course is very appealing for agriculture. So in many countries outside the European Union, they're using antibiotics as growth promoters. Now, using low doses of antibiotics will actually only stimulate bacteria for the surviving ones to develop resistance.
Sure.
And then they can get to humans through the food chain, for example, or direct contact. So a lot of antibiotics that are used in agriculture are the same as the ones that we're using to treat human infections, which means that if a resistant infection starts in the animal sector and comes through the food to the human, then we cannot use those specific antibiotics to treat humans anymore because the pathogens will be resistant.
Right. So
that's
this is a
one
major issue for us. And,
Absolutely.
And it's an important point that we can't just fix the problem just by looking at human health.
No.
We have to look beyond that. Yeah. So a lot of big challenges facing us in this area, but also a lot of opportunity, right, to change things and make a difference. So are there certain countries where we see superbugs coming from? Are there certain areas, or is this the kind of thing that is borderless, that can happen anywhere?
Yeah.
Well, it is borderless. I think we can agree on that.
Yes, yes. And I think that's important for people to know, because we do think that we are in a part of the world where we are safer. And of course, we in many ways, we have healthcare systems that are very advanced and good, the way with animals and agriculture and all that. But these, bacteria, they travel. They travel with you.
Yes.
And when you are going on holidays, for instance, and you might go into a hospital. In Norway, a lot of old people live in Spain half the year.
Sure.
Often they go into hospitals. In hospitals, you easily get bacteria.
Yeah.
70% of the bacteria you actually get in a hospital. And you carry it with you. And perhaps you feel okay, but after a few years, you get the disease and an infection, and pop, you have bacteria that are resistant to that antibiotics.
Sure.
Or you give it, it's transferred to your children or others, so you can't protect yourself in this global world.
Sure. Danilo?
Absolutely, yeah.
Anything to add?
No, yeah. Actually, I was also going to say that bacteria, and some of them will be resistant. They travel with people, but also through products like food products. And if you, in this evening, if you look at your plate and try to guess where all the ingredients come from, you literally have the world on your plate. And
That's a really good point.
depending on, I mean, you can only control so much. So there is a big shared responsibility, and you know, we're in this together.
And dentists, if you go to abroad to get your teeth done, it's also, you should be aware of that you might also get bacteria with you that are resistant to antibiotics.
So no borders.
And you mentioned shared responsibility. That's a really important concept when we're talking about antimicrobial resistance. Let's talk a little bit about individual responsibility. How often have we heard people say, oh, I'm feeling really poorly, I just want to go get some antibiotics to help clear it up? Tell me, one of you, what's wrong with that statement at face value? You know, and what can we tell people to help them understand when antibiotics are proper to use and when they just have no place in our treatment course? Who wants to start?
Well, guess first.
Ladies first.
Ladies and guess first.
The important thing is to know that we don't have antibiotics, a lot of them, as we have. They are getting resistance. Means we have
fewer and fewer are working.
Fewer and fewer are working,
of course.
And we don't have new ones coming in the pipeline yet.
Yeah.
That means what we have to use them only when we really, really need them, when it's urgency. So we shouldn't use them as we do nowadays, that we just think, I have a cold or a flu or something, I'm busy at work, I'll take some antibiotics, and then I'm going ahead in a day or two. These things, we should know that I'm not using them. It might be that me or my daughter needs them for cancer or another treatment, and they should be there.
And actually, the problem also is what you mentioned is you have the cold or the flu or something else. All these symptoms, they're very much the same. So as a layperson, you don't know exactly what it is that was wrong with you. Statistics tell us 9 out of 10 times it's a virus, which goes away by itself. And antibiotics will not help against viruses.
And that's the key point. That antibiotics is for the bacteria. And often it's virus. And we don't know that.
But who does know
I don't know
it? Someone knows it.
Well, some people spend a lot of time studying it. And,
but your doctor, if you go to your doctor, they can test and they can tell you, you know, whether or not you have the kind of infection that would even benefit from having antibiotics. You mentioned something really interesting, which is, you know, that we should be thinking about, even if, for example, we have a bacterial infection, thinking about whether we really need antibiotics, because we do want to preserve them and keep their strength and their power, basically, for those who desperately need them. And I'm a parent myself. I can think of many instances where I've had very responsible healthcare professionals tell me, yes, your child does have an infection, but let's wait a couple of days and see whether it clears up on its own, rather than just jumping into a course of antibiotics. This seems to me like a really responsible method, because you are waiting to see if it's necessary as opposed to just diving headlong into using it.
So our advice is that listen to your doctor.
And always really good advice.
Don't start arguing, and because he or she has a reason, and that is that your body will normally cope with it itself. So let it take some more days, and it will be okay. But the other advice is more and more of us are buying antibiotics when we are in Spain or US or somewhere, because it's not a prescription needed. And then we have it in the shelf. So we just pop it and take it when we feel we have a cold or a flu or an infection coming. We shouldn't do that any longer.
No, we absolutely.
I actually wanted to add to that. One thing is to listen to your doctor. First is to go to your doctor. Because as you mentioned, a lot of people, they either think for themselves what could be wrong with them, or they go on the web and find all kinds of advice. A lot of self-diagnosing that, and if you then have access to antibiotics, it's of course a dangerous combination.
Absolutely.
It leads to self-treatment.
So let's switch gears a little bit too, and let's talk about what happens if you actually get an infection that is resistant to antibiotics. Because we're telling people here, you know, we're saying don't overuse antibiotics. You know, even if you do have a bacterial infection, you shouldn't necessarily dive right into a course of antibiotics. maybe that's hard for people to stomach. Maybe they think, well, I want to get better, me personally, as quickly as I can. I want to do anything I can to get better quickly. What motivation do I have to be restrained in my use of antibiotics? Well, I think one motivation is what might happen the further along we get down this path where antibiotics aren't working for us. So I don't know, Danilo, I know you've probably heard about these things and seen them up close more frequently. What does a truly drug-resistant infection look like? What can that mean for the person who's going through it?
Well, of course, the person, if the doctor doesn't necessarily know what exactly he or she is treating, that could lead to treatment failure. As in many cases, we see that a doctor will prescribe something, even if it is a bacterial infection. Then if that doesn't work, he or she will prescribe the next and the next and the next. So one way to avoid that is to order a test to find out, okay, what pathogen are we dealing with? What is causing the illness? What particular attributes does this illness have? So is it resistant to this? Yes, then maybe something else will work. So it's always a good idea to get a test and find out what are we dealing with so that you increase the chances of a successful treatment.
What you say is very important because too often, and also in other countries, they use the wrong antibiotics and the sort of broad specters instead of using the ones that are targeting
Very
your
specific.
and also if you are using often antibiotics, every time some of the bacteria will get resistant.
Yeah, right.
So also you yourself will end up perhaps the day you really need it, that it doesn't really work on you any longer.
Right.
So that's also why if you only think of me, still you should have sort of a bit.
Right, understood. And I think, again, you're bringing up more of this shared responsibility concept, right?
Yes.
We have our individual responsibility, but then there's also this health worker responsibility. You know, you are saying it's really important to order a test. Well, we as individuals can't order a test. I mean, that's the responsibility of healthcare professionals, right? To say, let's figure out exactly what the pathogen is. Let's figure out exactly how we should be treating this. What are some other ways that healthcare workers play a really vital role in ensuring that we aren't overusing or misusing antibiotics?
That's a very good question. Well, I think if I may, I think the best course of action is to prevent infections to begin with. As you mentioned before, unfortunately, people do not only go to the hospital to get well, some of them get sick as well. And most of these infections that are starting in the hospital are preventable through normal hygiene precautions like washing your hands. That's actually I guess the number one intervention that we could recommend.
A simple intervention.
A very simple
and low
intervention,
cost.
yeah, which has been around for a long, long time. But of course, we do understand when people run very fast and they have to do lots of things. That's maybe some of the first things that that are not followed through consistently. And unfortunately, bacteria and other pathogens are very opportunistic, so they only need one chance to move from one to the next, and then if they survive, things can go wrong. Yes, exactly.
But another thing also is to prevent the disease is to take the vaccines that we have. Also, luckily, we have a lot of vaccines now. That's really fantastic that we are able to prevent some diseases. So if there's a vaccine existing, one should actually take it, and that's more and more important in the future to avoid getting the disease. That will also get you an infection, and you don't have antibiotics, and in the very end, you might die.
Absolutely. Hand washing, vaccines, these are things we know work, but people don't always do them. Anne Lise, I wanted to go back to you. You said something about how when we go see our doctor, we shouldn't be bullying them or pressuring them into giving us antibiotics, especially when we don't need them. But there's a flip side. There's a responsibility that health professionals aren't able to be bullied, right? That they really stand their ground and make sure that they're prescribing antibiotics in a responsible way. Isn't that correct?
Yes, and we see a change now, because I see actually like WHO has been working on this for years, and politicians and professionals, and there are strict goals like in Norway that you shouldn't use more antibiotics than such and such, and we should sort of get down to a lower level. And those instructions has gone out to the healthcare workers and to the GPs, and we can see the results. Because 10 years back, my GP will say, prescription antibiotics.
Sure.
And they don't do it any longer. They've learned
Yeah.
the lesson,
Right.
I think.
And I think just to add to that, what's really important is also to stress that it's not just about bringing down the numbers or the amounts used, but bringing the unnecessary use, closing that one.
Right.
Unfortunately, a lot of the countries that we work with outside the European Union, but maybe even within, there's also another type of pressure that, of course, a patient goes to the doctor and only feels him or herself treated if you come back with a prescription or some sort of care, some proof that, yes, I was listened to, and through the best of the person's ability, this is what I need to do or not do. In many countries, if you go away from a doctor that does not prescribe you, you go to that's not a good doctor. I go to the next one.
Yeah,
so there is also some solidarity and accountability within the profession. That the whole profession needs to agree that this is our common course of action. We will not support over-the-counter sales and use without a prescription, or even a prescription for the wrong reasons.
Right. But I think people, when they listen to us now and they understand this more, people are they will then change their behavior a bit. I think they respond because we can all understand that we need to be able to treat those that are really sick, and that I can be without a lot of the antibiotics, even if I feel more sick a few more days or things like that.
Yeah, but no, it's true that maybe when we reach people with the message that this affects the future health of all of us, then they're able to see the reasons for for being moderated in our use of antibiotics today. Danilo, this is probably a question for you, coming from a watcher, and they ask, what will be the most difficult disease to cure in the future? Or which diseases might be the most resistant? Even classes of diseases. It doesn't have to be
classes of diseases. Well, I do think, of course, the hospital environment being what it is, with lots of different infections in a small place, whatever is hospital acquired is probably one of the biggest challenge, I think. Whereas in the community, it may be diluted, but I guess it's more difficult to spot it in the community because it is maybe not very concentrated. But my guess would be healthcare-associated infections, as they call it. So things that happen in the hospital.
Yeah, so it will be surgery very often, or very advanced treatments, and that's where cancer comes in.
Sure, yes, please
again,
tell us more
because
about this.
Because if you're also transplantations, if you have an organ transplanted, or so it also could be that, or any surgery, because you can get infections in the around in surgery. So any kind of that, and as you say, hospitals. But we're now talking about diseases, but it's also when you get injuries. You are playing football and you get kicked and you get a wound and you get an infection. So that's also a part we should know of.
Absolutely. And actually, I have a question here from Olga in Poland, which is really following up on what you're saying, Anne Lise. And Olga asks, for patients after organ transplantation, what would be good recommendations in terms of protection from infections?
Well, that is, the hospitals should really know. But what they do now is that you're more and more in isolation.
Yeah.
So what happens is that to prevent, also they will treat you over a longer time and in isolation. So that to avoid infections.
A really sterile, clean environment.
Yes, and also to avoid others to get those bacteria. So things are happening all the time. Healthcare personnel are very aware of this. The human effect of this is that I might be isolated for a very long time, and that is a life quality question. When my dear ones might not be able to visit me, or they visit me with masks and gloves and everything. It's good, it's like that, but it's not the way we want life to be.
No. It's not ideal, but
exactly.
But still, it's important to know that it will be more treatment like that in isolation.
Yeah. The more we see antibiotic resistance, absolutely.
Yeah. And indirectly, it can also affect livelihoods if people are away, not only from their family, but also from their work for a longer time. So
how long can we sometimes see a bacteria-resistant infection drag on? I've heard stories where it's weeks and weeks because, as you say,
Yeah.
they sometimes just keep cycling through the wrong antibiotics. I mean, do we have any information,
Any hard data on that? Or-
data on sort of how long they can last?
I think that's no. I wouldn't
No.
wouldn't be able to give you a number, but you can just imagine that.
Anecdotal data, maybe anecdotal evidence, maybe about
Yeah.
how long you've seen them last.
I'm not sure.
No.
I'm not going to give you a
I'm
number.
putting Danilo on the spot.
A little bit, yeah. No, but again, if you're looking at repeated treatment failures, that
Yeah.
can take a long time.
Yep.
Or if a treatment is not completed, it may seem to go away, but then it starts proliferating again, and then it comes up again. So you see this.
And your immune system, if it's low,
Yeah.
could be of many reasons. Could be because you have had a treatment, a long treatment, but it could also be that your health itself is that you have a low immune system.
Sure.
And then you easily get new infections, and they might last longer also.
Danilo,
Yeah.
you made a good point that sometimes treatments aren't completed, that people don't actually follow through with them all the way. So this is another problem, right?
Absolutely.
We have the
Yeah.
problem of overuse, of being
Underuse.
prescribed, but underuse as
Yeah,
well.
absolutely. And in the cases where antibiotics work, I mean, it is really a miracle drug. You start feeling well after just a couple of days, and then you think, well, I'll save the rest for when I really need it.
Yes.
But that, of course, doesn't mean that
You
the
really need
infections
it
go.
then,
You
right?
really
you
need it
it
right
then
there.
when
Yeah.
the doctor's prescribed it for
Exactly,
you. Right.
yes.
So that's another important thing for us to remember, more on the individual responsibility level. We have another question. This time it's coming to us from Georgia. And they say, thanks for a very interesting discussion. You're welcome. And they want us to remember that when we talk about AMR, we shouldn't forget to talk about multidrug-resistant tuberculosis.
True.
Danilo, could you maybe just give us, I know it's not your specific area of expertise, but could you talk a little bit about, when we hear multidrug-resistant tuberculosis, what does that mean and why is that important?
Well, I would say multidrug-resistant tuberculosis is a very extreme form of multidrug resistance. It's tuberculosis is a very visible disease with a horrible outlook, and I think this is also why it has been recognized in tuberculosis for a longer time than antimicrobial or even antibiotic resistance in general, because you recognize it. You can see people literally dying or fading away in front of you. And the treatment itself is a long treatment where it's really important to go through the end of the treatment, and you have to come back again and again, and there's a lot of isolation involved.
Isolation, and as you said, loss of income, ability to work, and
all these.
make a living.
So I would say the multidrug-resistant tuberculosis is a very visible problem, which I also think that's why the recognition started probably there, or has been around for a longer time. But yeah, it's like with any other antimicrobial resistant infection, it's really important to address.
Yep. And a lot of work is being done to do that in our
Yes.
region, here in the European region. So I have a question here that's actually coming all the way from Ethiopia, and the question is really about countries where they don't have a national strategy for the prevention of antibiotic resistance, where there's not that national level action being taken. What can we do in those instances? When you can't sort of look to your national government to be leading the charge, what else can we do? And maybe this is a great question for you, Anne Lise, since you come from sort of that more, not government angle.
But the problem also is in many countries you need more antibiotics. We use it too much in many countries, but other countries in the world, they don't have access to them when they need them.
Sure.
So that's the big problem, and that's why this is so confusing for people when we talk about antibiotic resistance. So that is one thing, is to get it when you need it, and the other thing is to know what kind of antibiotics to use. You were mentioning it, like you need to take tests to target the right one. In many countries, they don't have those tests.
No, exactly.
So you give the antibiotics that are called broad-spectred, and that is not good because they might give you more resistant
Right, exactly.
bacteria.
If you're treating something specific with something broad, then it's more easy to develop resistance.
What do you call in Norwegian as a Leger uten grenser, the frontier?
Doctors Without Borders.
Yes,
Yeah.
they've been worked a lot in this area in many countries, and they also have equipment that are quite that doesn't cost much. That they are saying that a lot of countries like Ethiopia should have. So I think one thing is to listen to them and organizations like us to help advocate their governments to at least get the kind of equipment that could be of more help, and also know that often they are in countries where they need antibiotics more, and their situation might be different from what me and you are talking about.
Actually, if I may follow up, because I'm really happy with this question, because I was afraid that the discussion would go a little bit towards the direction where you have easy access to a doctor, access to tests, a full arsenal of antibiotics, and of course that's not the case in many countries. So this is extremely important. I'm very happy that it's raised, and you're absolutely right that there is a responsibility for governments who have different priorities and limited resources, but governments need to be elected. If you as a population are well educated, and I think there's certain things you can start demanding as basic healthcare, of which effective antibiotics should be a part.
And vaccines.
And vaccines.
That
Yes.
even they could have even more vaccines, and sometimes they can also get another prize for vaccines in those countries. So that is also to prevent you coming in that position.
But this is such an interesting point from both of you, that the situation with antibiotics varies wildly from country to country, and so there's probably not a one-size-fits-all approach to how we deal with antibiotics, which again is important for that One Health approach, right? That we need to be working across sectors, and we need to be working across contexts to figure out the best way to address this problem. Our time is actually almost up, but I do want to share one more question. This one comes from Elena from Poland. And she asks whether there's any research into alternatives to antibiotics to use in relation to cancer treatment.
So there is hope. I was thinking we can't end this discussion with no hope and everything is black.
No.
But the problem is that there's not a lot of new antibiotics out there, and it takes a long time with research and to come up to new solutions.
Sure.
But there doesn't need to be other antibiotics. Could also be something completely different that will have a wow effect on us. And we can see something coming up, and we have hopes. But what we need is governments that talk with the industry to also make new models. So the industry will also make medicines that I know will not be used of us in the beginning, but we have to have it here on the shelf for later use. So then again, governments should find models with the industry, so they will continue research and produce new antibiotics and other medicines. And in my view, I do have hope. Yes, we just need to be aware of the situation and do our part.
That's really that's wonderful and hopeful to hear. The situation is dire, it's urgent, but there are opportunities on the horizon. Maybe that will help get us out of this quandary. As I said, we're almost out of time, but Danilo, maybe we'll just end with you and go back a little bit to that One Health approach. Do we see anything happening that gives us hope in this area? Do we see any of this multi-sectoral, cross-sectoral action taking place? Feel free to share examples, or what can we do to encourage it, to boost it further as we go forward?
We are seeing action, but it's right now, luckily it's been moving up to the highest levels of government, so the United Nations are now discussing it, because of course if you want to encourage communication between sectors, you have to go above the sectors in many countries. So that's a very, very good start, but then of course now this high level attention needs to dribble down to local action, right? But that we can really see it also at the international level. International organizations are working more and more together, talking more together, giving similar messages. But really there's still a lot of work to be done when it actually comes to the local situation. But it starts with awareness and then with action and behavior, and then we'll take it from there.
And maybe it has to be both bottom up and top down, right?
Absolutely,
we need to build the awareness from the bottom up, but then we need to take the action from the top, from the highest levels, as you say too. I want to thank you both so much for being with us. It's been a really interesting conversation.
Thank you.
I've learned a
My
lot.
Yeah.
I'm sure our viewers have learned a lot. So thank you, Danilo. Thank you, Anne Lise.
My pleasure.
I hope everybody has a really wonderful rest of World Antibiotic Awareness Week. Please feel free to send in additional questions. We'll do our best to answer them. And of course, you can always look on the WHO websites for more information as well. So thanks again for joining us today.
Yeah.